Thanks for joining us, folks. You're watching Luzerne County Community College Report, done every month to bring you up to date on what's happening at this great college. Joining me now is the president of the college, John Yudichak. John, how are things going?
Going very well, thank you, sir.
You're settling in?
Yes, enjoying it very much.
You missed a legislator?
Not at all, not at all. No, this is the best place to be. We have some very, very talented people, outstanding students, and the community impact that we have on the region is something that's very, very special to be a part of.
Best deal in town.
Best deal in town.
Best deal in town. Now, we're going to talk about the health science program, and we have some guests coming on just to give our viewers an opportunity of knowing what's happening here. Give me an overview of the building and the health science program.
Well, the health science program is our largest program, probably our most successful, certainly by reputation and certainly by impact in the community. Nursing is the #1 profession in northeastern Pennsylvania. Healthcare is the #1 industry in northeastern Pennsylvania, representing about 20% of the entire workforce is involved in healthcare. And whether it's our nursing program, our respiratory therapy program, our surgical technician, our dental hygienist program, our paramedic program, on and on and on, Luzerne County Community College is meeting the needs of our students and the workforce in the region. The Health Science Center built a number of years ago. It was a vacant building. Travelers Insurance had built a building, 3 stories, about 52,000 square feet. They left town. It was vacant for 3 or 4 years. We partnered with the community college and the city of Nanticoke, the municipal authority of Nanticoke, and we were able to bring that building into the campus of Luzerne County Community College. It brought the campus and the city together for the first time. Main Street and Kosciuszko Street, we became one campus, not only with the Carrozza Health Science Institute and the Carrozza family. By the way, Francis and Mary, who unfortunately have passed, donated a significant sum of money to put their name on the building and to create a legacy. Mary was a nurse, and she wanted to leave a caring legacy, and that legacy carries on in every student that we produce out of the health science program. And then the Paganini Culinary Institute, Joe, who was Grotto Pizza, knew him my whole life, great man, lived well into his 90s, also contributed a great deal. And that really brought the city of Nanticoke and the campus of Luzerne County Community College together, along with the Public Safety Institute, all in. That was probably about a $50 million investment, not only in the community college and our students, but in the city of Nanticoke and in the county of Luzerne.
You know, it's amazing. You know, if you look at some of the people who have been through the college and nursing program and different programs here, the success that we have and the fact that you fill the needs in the county, which was the purpose of the community college. Today we'll be talking about different health services that they have. Anything that the public should be aware of with in the science department?
Well, the need for nurses. We have a great shortage in Pennsylvania and throughout the country. The federal government anticipates there will be well over 200,000 openings in nursing by 2030.
Wow.
We've produced close to 5,000 nurses over the last 50 years. We've celebrated 50 years of the program, I believe, just about a year ago. That is a tremendous impact. And the mission of the community colleges is to create student success, individual success, but also community impact. I keep saying it over and over again to our great faculty and staff here, but to the community. Community is in our name, community is in our mission, community is what Luzerne County Community College is about building. And building a community means making sure that we have a quality, affordable healthcare system that serves the needs of the residents of Luzerne County. Luzerne County Community College is playing a role in making sure that healthcare industry has the best and brightest, and the best and brightest are the graduates of Luzerne County Community College's health science programs.
I ditto that. Talking about the great teachers we have, we're going to be talking about the different departments. And coming up now is Susan, and she's the Dean of Nursing and Health Services. All right, Susan Koronkiewicz is the Dean of Nursing and Health Services. What a great program the nursing program is. I mean, I was telling you when I was the chairman of the board here many years ago, you know, I started the nursing program, I think it was 25 or 30 students at that time. Now you're up to what, over 100 and some?
We have grown. Our fall cohort is 160 students strong.
Tell me about the program and the great things that you're doing.
So our program is an associate degree nursing program, and it meets the requirements for state board of nursing and national certification, national licensure. There are different entry pathways into registered nursing, including still some diploma programs that are out there, and then also a baccalaureate or bachelor's degree programs as well. We have actually an articulation agreement partnership with King's College that does offer what we refer to as a 1-2-1 program, and we have a whole
What's that 1-2-1?
So 1-2-1 makes students who are enrolled in that dual enrolled in both King's College and Luzerne County Community College for the purpose of a nursing degree. So they receive their pre-licensure education in nursing here at Luzerne County Community College, and then they continue on with King's College for a post-licensure baccalaureate or bachelor's degree in nursing. So their pathway, you know, they know from the time that they come in through King's that they are students at both institutions, and they take classes in both institutions to meet a longer-term goal of an eventual bachelor's degree. But they can sit for their licensure exam after completion of our associate degree program. So they actually get both degrees.
Oh, good. So if they didn't go for the other program, this graduate associate program, the workforce is out there for them. They
That's
have
it.
jobs.
Yeah, that's absolutely correct. And
Are
a
they-
lot of people will opt to do that because, as is well known in the industry, most employers are going to offer tuition reimbursement, and they're able to continue their education for a bachelor's or eventually a master's degree, whatever their goals might be, and they get that support, that financial support from their employer.
Do you have health facilities saying we need this, we need that?
Oh, yes. They need everyone.
Yeah.
They need
So if they pass, they're sure an opportunity, a career.
I don't know of anyone who doesn't have a job post-graduation who wants a job, you know, that it's a given. We have such an incredible shortage locally, nationally, even internationally, of healthcare workers of all types. I do also support all the other health science programs that are in our center, in our school. So I am the nursing administrator, but I also work very closely with the directors of the other health science programs. And they'll all tell you today that there's a shortage of their workforce as well.
Do you do a lot of hands-on in the training?
Absolutely. If you've been into our nursing, our health sciences center.
I'd love to.
Yes, you
Because,
should come over and see
yeah,
it.
being that I started,
I
I would
tell
love.
all prospective students, come and tour. Any program that you're learning, come and tour. Our facility, I believe, is second to none in the area. We have a state-of-the-art skills lab and simulation center. We're really building our simulation program even more, where we have high-fidelity mannequins, and we have students practice in a safe environment where we can control everything, and it's really cool. A lot of technology, but we're always looking to improve, and we're also, our initiative right now is to pull more of the health science programs together for interprofessional education, because we all work together in these healthcare systems, and we need to know how to work together, and what does respiratory therapy do, and how do they work with nursing, and how does EMS services and surgical techs, you know, work together.
We're going to find out.
Yeah, we
have to
are.
come up. My wife's a registered nurse. Okay, of course she's the COO of the company, but she's always getting offers for helping
Right.
a job. So
Our local clinical partners love hiring our students after graduation, because the majority of our students, and I don't have an exact figure, it's like 90 over 95% of our students are local people who stay local, as opposed to some other programs that have students coming from other states, who, may not remain here to practice, most likely don't remain here to practice.
Keep up the good work.
We will.
Now we're going to talk to Karen Rainey, who is the director of the dental program here. A great program as usual.
Yeah, actually in the dental health department we have two programs. We have dental hygiene, which is it's a 2-year degree. They earn an associate's degree after 2 years. It's full-time only. And dental hygiene is in high demand in the area. I get calls from dentists in the area all the time. Our graduates have no problem getting jobs. Our dental hygiene program, all of their requirements are met in the health sciences building. They don't need to go out to other locations. So we have a clinic right in downtown Nanticoke. The students see patients, they treat patients in the clinic. Everything is supervised by licensed dental hygienists and dentists, and it's a wonderful program. We have a great facility, everything's state of the art, and so they're able to complete all their requirements there. In addition to the dental hygiene program, we also have a program, it's the expanded function dental assistant program. So a lot of people don't know what expanded function dental assistants are, so let me explain that.
Yeah, please.
We shorten it to EFDA, EFDA, expanded function
Still
dental
explain it
assistants.
to me.
Yeah, so they are dental assistants who can do more than just a dental assistant. They can do everything that a dental assistant does, sterilizing instruments, passing instruments to the dentist, mixing materials, but they have some other functions that they can do. The biggest one being that they can actually place the fillings. The dentist is the one that will do the drilling, but the expanded function dental assistants actually can place the fillings, white fillings, silver fillings,
Wow.
they can do sealants. Yep, so very exciting. And this is a program, it was only restarted again about 2 years ago, and we restarted it because there was a demand from the dentists in the community telling us that they wanted some more EFTAs. So we started with 9 students. We're up to 17 this year. So we're growing that program.
And they're
too.
all guaranteed jobs.
Everybo's been getting a job. Yep.
Safety inspections, and the state comes in and have to approve different programs you have, right?
They have to come in and they approve things like the radiation equipment. We're accredited by our own accrediting body. In addition to Middle States, we have CODA comes in and we do accreditation through them.
So meeting the needs of the community, which is a community college all about, you know what specific is needed in the counties?
Yeah, I get calls from dentists in Lackawanna County as well as Luzerne County. Our students come from pretty far away. It is a very desirable program right now. So yeah, it's terrific. They were able to get jobs, no problem.
How many students you have in the program?
In the dental hygiene program, we have a maximum of 27, and that is we're limited by the number of chairs that are in the dental clinic. But we have about 200 students apply every year for 27 seats.
It's amazing,
So-
and we need dentists on top of that too.
That we do.
And
We do.
the alumni that you have, okay, people who've gone on there, what would be the next step after dental hygienists if they wanted to progress?
So yes, many of our students will go on to get a bachelor's degree. Right now, if you want to teach
Yeah.
in the dental hygiene program, you need a bachelor's degree right now. So a lot of them will do that. Some will even go on to get their master's degree.
So you're peaked out right now with students.
Absolutely, yeah.
So if someone wanted to get into the program, they should be applying now?
Absolutely, yes. Our deadline is January 5th, and so yeah, this is the time. In the fall is the time to be taking courses and applying now.
Yeah. As I asked Susan, do you do hands-on as well, going?
Everything is hands-on. The clinic, they're seeing patients, they're seeing friends, family, and patients from the community. So it's an addition to the students learning, it's a great service to the patients of the community.
That's great. It's so good to hear these things, servicing the community and the price, the cost is so reasonable.
Oh, it is. It's
I
a great
just said
deal.
it's the best deal in town.
It is.
This is Karen Rainey, my friend. She's the director of dental. We're talking about the science program we have here at LCCC, Luzerne County Community College. This is a monthly report. We're going to take a break. We'll be back with John Conrad. Well, welcome back to Luzerne County Community College Report. We do it every month, my friends, giving you an update of what's happening at this great college. We're talking about the science program today. the many facets that we have. Joining me now is John Conrad, who is the Director of Respiratory Therapy. John, how are things going?
Things are going great.
How many students? You're okay with your students?
Our students, we're allowed to have 28. We're limited by accreditation in space, but our students are doing good. I got a first-year class. We're not at capacity. We have about 20 students, but they're wonderful.
Tell me about, well, before that, there's always something special happening. In the last week in October is usually what?
Well, Ronald Reagan, when he was president, he designated the fourth week or the last week in October as National Respiratory Therapy Week.
Yeah. Tell me about your program.
My program, well, it's growing. We are limited by 28 students. And since COVID, we are becoming recognized as essential, more essential members of the healthcare team. We manage the ventilators. We manage people with asthma, other breathing difficulties. Matter of fact, I remember when I was a young man, the pulmonary function at Nanny Cook State General Hospital used to do black lung screening. So we've been around for a while.
Your experience?
I have 43 years experience in respiratory therapy, last 12 in education, and the rest of it I was a clinical practitioner.
Tell me about a typical, process that you're doing in teaching of the respiratory therapy, because all these services are so important.
We teach obviously how to manage mechanical ventilations. We have a high fidelity simulated mannequin that's hooked to a computer that we can change different aspects of the lung. We go into anatomy, physiology, pathophysiology. When our students are finished, they get their associate degree, but they're also eligible then to move on to baccalaureate degree programs.
And do hands-on as well with your students?
Most of it is hands-on.
Yeah.
We do clinical components at most, if not all, of the area hospitals.
Job opportunities. I mean, stupid question, but
Outstanding.
Yeah.
Outstanding. As of last year, students were being offered sign-on bonuses like $25,000, $30,000 just to sign on to places, and all of our graduates.
I'll take the job.
And all of our graduates have the potential to get jobs.
What would be the next step after getting their associate degree?
After their associate degree, they can get their baccalaureate, and then they have a whole bunch of avenues to explore. One is they can go into administration. Two is there's a brand new field of respiratory therapy called an advanced practice respiratory therapist, which is a lot like a nurse practitioner, only it's specific to respiratory therapy.
Healthcare has been changing constantly. What are some of the advances that you've seen throughout the years in technology and in better healthcare?
Well, I think one of the big things, not technology, is so much as there's care maps and standardization of protocols so that we treat patients the same way, according to the same standards, and we get better throughput through the hospital, decreased length of stay.
It's interesting how things keep on growing. Huh?
Oh, and technology, all our ventilators now are microprocessor.
Well, as usual, we're very happy and proud to see what the results that this college is producing. I mean, Luzerne County Community College is just amazing.
I love Luzerne County Community College. I've always wanted to teach here since I started in my career.
Okay, my friends, we're going to talk to Mark Ercolani now, who's the Director of Emergency Medical Services Program here at LCCC. Mark, as I'm talking to these people and learning about the health science, it's just amazing of what's going on here. Sure. Tell me about your medical services program.
We run the emergency medical services at Luzerne County Community College. We have the emergency medical technician and paramedic programs. The emergency medical technician program is 4 months, one semester. Paramedic program is 1 year for the certificate and 2 years for the associate degree.
What do they learn?
Pre-hospital care. When I graduated from paramedic school in 1983, we didn't have all the technology that we have now. So they have put a lot of trust in the pre-hospital care provider to do 12-lead cardiology, recognition of strokes, trauma care, trauma resuscitation, blood component and blood administration. So the role of the paramedic over the past 4 decades that I've been involved has expanded.
Now, where do the students go? You said you have 3 different programs. You have
Well, we have 2 programs. We have the
4-month?
The emergency medical technician, which is the 4-month, 1 semester, and the paramedic program.
What do they learn in that program?
Basic care, but they also are administration, medication assistant with the patient. They also, they're the ones who transfer the patients back and forth and assist the paramedic.
So they would go to local EMTs?
Hospitals. Yep.
Okay.
Yep.
And then the second program?
Is the paramedic program.
Okay. And what's involved in that program?
Paramedic is advanced level care. It's an expanded program where they learn how to do, like I said, cardiology, medication administration, trauma care.
You focused in on any specifics in the program?
Mostly cardiac care, neurovascular care, trauma, care of the newborn, care of the neonate, OB/GYN, because these are, at work, it's not a boring job anytime that...
no, yeah. They're critical positions.
Sure. When 911 calls you never know what you're going to have. You never know what you're going to get into.
So they're trained in all these different facets.
Yes.
Okay, and they need to know because life's depending on this. Okay?
Right, and there's no one there but them. They're the tip of the spear. They are the first responders. They're the ones who are coming into your house or to the accident scene.
Yeah. Now you also you're on the helicopter, you said as well?
I do. I've been on a helicopter for 15 years. I work for Lifelight Geisinger at Volca Base as a registered nurse.
So tell me about that helicopter. What is it prepared? What does it have inside of it?
Well, we take our graduates from the paramedic program and they take jobs in the helicopter. So I get to work with some of my graduates over the years, which is it's a good thing.
What are they equipped for, these helicopters?
It is basically emergency department. It has all the equipment that like the respiratory therapy department has. They have ventilators, they have monitors. We transfer very critical patients, and when time is of the essence, sometimes the helicopter is the best bet. Yeah.
In training your students, okay, which is so critical, are there vigorous exams that they have to go through, the pass to? I mean, because they have people's lives in their hands right now.
Sure. So they are state and national registered when they graduate from our program. But most of our education is scenario based. So I take the scenarios and the cases that I've had and put them into scenarios, and we run treatment protocols for those patients, and we use simulation quite a bit.
So a dumb question. I guess there's a need for that, right?
Oh, no doubt. Yeah.
I mean, it's just amazing. How many students you have?
We have 19. We're limited to 25, and we have 19 in the program now, in the paramedic class. Yeah.
And everyone moves on.
Well, 100%.
Yeah.
Every one of them will have.
And anything you like to say in closing about your program? I mean, I just think it's fantastic.
I just remember that we need more.
Yeah.
We need more out there, because if we don't have EMTs and paramedics, then you're going to have a hard time getting to the hospital when you're sick.
Yeah, but you have to have that desire.
Sure.
We really
it's a
have
special
that.
person.
Yeah, nursing program. I mean, as I mentioned, Susan, my wife's an RN. She's always be an RN, but you have to have that compassion. And I congratulate everyone who's in the health science department here. They're doing a great job. Keep the good work up.
Well, thank you.
The programs are open. The opportunity is there. Go to their website. This show is seen every day on SSP TV 13 and 513. Also on the Wilkes-Barre Channel 92 weekends, 7, 11 o'clock. And also our website. Very informative. We'll see you next time.